Um, All right, everyone. Welcome, welcome. Thanks for being here. My name is Ariana Sessoms, and I'm with Futures Without Violence, based in Washington, D.C. And I'm also a member of NRCDV's Intimate Partner Violence Prevention Council. And I will be your virtual room monitor for this session. So this learning circle is on children's advocacy with the Illinois Coalition Against Domestic Violence and Children's Advocacy Centers of Illinois. I am happy to introduce each of our wonderful presenters here today. I will start with Ariana Speagle. Ariana was born and raised in Central Illinois, where she discovered a love for community involvement that led her to one of her first passions, restorative justice. Ariana practiced her passions both as a youth volunteer and later as an employee of a local youth-centered restorative justice organization and as an employee at her local sheriff's office, supervising the expungement process. After obtaining her degree in criminal justice and sociology at Millikan University, Ariana started working for the Illinois Coalition Against Domestic Violence as the Prevention and Outreach Coordinator, where she has the honor of championing violence prevention every day by supporting the prevention and outreach work of over 50 domestic violence programs in Illinois. Ariana also loves spending time with her two sweet pit mixes, Nova and Apollo. Very unfortunate we don't have photos today, but happy to have you here. Next, I'll introduce Chloe McMurray, who is the Chief Technical Assistance and Training Officer at the Illinois Coalition Against Domestic Violence. In this position, Chloe leads the technical assistance and training team in developing innovative solutions to help over 60 domestic violence agencies in the state reach their yearly goals. She creates and implements best practices like trauma-informed statewide needs assessments and other resource development. She previously worked for the University of Illinois' Child Protection Training Academy as a curriculum designer and facilitator, working closely with a pilot project to provide simulation training for incoming child welfare investigators. Before moving to Illinois, Chloe worked at the Tennessee Coalition to End Domestic Violence and Sexual Violence, assisting programs in Tennessee with their advocacy work, prevention initiatives, and cultural responsiveness. Chloe firmly believes that by advocating for the most isolated and voiceless populations, we are advocating for everyone. And her three favorite things in her life are her dog Odie, her wife, and Jif peanut butter, in that specific order. Next, we have Carrie Cohan, who currently serves as the Chief Program Officer of the Children's Advocacy Centers of Illinois, following 17 years as the Executive Director of the Madison County Child Advocacy Center. Prior to that, she served as the director of 3 community-based child abuse prevention programs serving Northeast Florida. Carrie has a bachelor's degree in psychology from Truman State University and a master's in social work from Florida State University. Carrie previously served as an appointed member of the Illinois Children's Justice Task Force and currently serves as president of the board of directors of the Southern Illinois Child Death Investigation Task Force. And then last but certainly not least, we have Stephanie Jewett, who is the training coordinator at the Children's Advocacy Centers of Illinois. With over a decade of experience in child advocacy field, she has served in multiple roles on the multidisciplinary team, bringing a well-rounded perspective to her work. Stephanie is deeply passionate about child advocacy and has successfully created and directed a comprehensive prevention program, demonstrating her commitment to protecting children and strengthening communities through education and collaboration. So you all are in for a treat with all of these amazing folks here. Thank you so much, and I will turn it over to our presenters.
Thank you so much, Ariana. We really appreciate it. I am excited to be here with such an incredible and empowering group of women. So Stephanie, Ariana, Carrie, thank you all so much for being part of this project. I think as often as I do trainings, I will never get over the absolute awkwardness of being introduced. So thank you all for that. It is really great to be here and to talk about this project. So this project really came about, our previous leadership at ICADV had sought a funding opportunity with our local, well, not our local, but our statewide Department of Children and Family Services. And it was a one-time grant to do, it was really broad. It was to do something at the intersection of domestic violence and child welfare. And so we got the funding, and it was not even an option to not collaborate with the Children's Advocacy Centers of Illinois. And when I say that, I don't mean that it was written into the funding or anything like that. We just knew immediately, you want an expert on your side. So we went to the experts. And I don't know, some of those earlier conversations happened so long ago, it feels. I feel like that was decades ago. It wasn't, it was mere years, maybe a year ago. But it was really instrumental for us to pull in Carrie and Stephanie and their executive director to say, this is what we want to do. How do you want to do it? And we got some of that thought process, and we got thought partners and said, let's make this happen. And so part of the reason we went, and so what we did was we developed this campaign called Be the One. And it was, be the one, and I'll let Ariana talk more about that and what that really entailed, but it was be the one child who overcomes, be the one parent who finds the strength to leave or to stop abusing or to, whatever the case was, or be the one person who steps in and changes the trajectory of a child's life. And so we went with that campaign. And I think Carrie was the one who said, well, let's do toolkits that would help the advocates, because those are the folks that are on the ground, the frontline staff doing the work every day. And so they're the ones who need that support. So I think that's pretty much how we got started. There were a few meetings there in the beginning, and then there were funding delays, because there always are. And we had a little bit of a lapse, and then it was crunch time and we dove in. I know I learned a lot about project management, we'll say, but it was incredible, and it was a lot easier to have this project, even though it was, sticky at times with funding and with timing. It was easier to complete the goals and deliverables of this project because of the partnership. CACI and ICADV, I don't think had worked super closely together in the past, but we're all we're state entities, so we're kind of this statewide force in each of our respective areas. So it was really beautiful, at least for me, I won't speak for everyone, to see us come together and create something that was empowering for both parents and children and advocates as well. I mean, this was really especially targeted at the advocates and focused on their extensive work. So I think that's pretty much how we got started. But Carrie, Stephanie, let's hear from you all about, what your perspective was. And maybe it was horrible and I'm just an idealist. I don't know.
This has been a great collaboration. And I want to highlight for everyone on this call, because I don't know if every state does this, but I'm really proud of this in Illinois, that the leadership of the Children's Advocacy Centers of Illinois and the Illinois Coalition of Domestic Violence and the Illinois Coalition Against Sexual Assault, the leaders of those entities, which are statewide membership and funding organizations, meet regularly and have, from the top down, solidified partnership, particularly I would say in the last 5 to 7 years. Like that has improved significantly. And things can happen differently when the top down leads partnership. And you see that in a variety of ways, where we pull our partners in to speak at our directors conference. For example, we have had the other state entities come into our directors conference and speak to the Child Advocacy Center directors over the years. So this partnership, it was neat. It was fun. We feel honored to have been asked to participate in it. And honestly, we'll talk about this later, but we hope this is not the last time, right? Like, I think this might have been one of the first things like this we have worked on together. I hope this is the start of something that we do a lot more of. I also want to highlight that ICADV brought in Prevent Child Abuse Illinois as well as a partner to this project, and they weren't able to be on here today, but that is another statewide organization that participated in this project, and you all at ICADV were very thoughtful in bringing in them as well. So, and for us at CACI, we knew that we needed Stephanie to help work on this because she was an advocate, and she worked at a local center, and she did have a relationship with her local domestic violence agency, and had like frontlines experience with how something like this could benefit advocates who are out in the field. And so we were honored to be asked. It was a fun partnership to be a part of, and the rest of the group will talk more about details about it, but we certainly hope that there are more opportunities for us to do this as time goes on.
Thanks for being a part of this, Carrie and Stephanie. We were really honored to have you all as partners, as well as Prevent Child Abuse Illinois. But I just want to do a quick review of the Be the One campaign and the tools for anybody that was not here yesterday at the town hall panel, or just anyone who needs a refresher. I think we had 8 panelists, so that was a lot of projects going on. So I just want to share my screen real quick to do a quick refresher. Give me 1 second. Okay, can everybody see my presentation?
Yes.
Okay, great. So, we landed on this message that we call Be the One, which, as Chloe kind of talked about, be the one adult, friend, advocate, teacher, who amplifies safety and support for children and teens and survivor parents. It's also a message that anyone can be the one to start new family cycles and break harmful generational habits. So we also, in addition to the toolkits, well, I'll get to those in a second. We will be launching our Be the One social media campaign, which is targeted specifically for parents aged 19 to 40 and children aged 8 to 18. Anybody can and will see these, but we do have a target audience because of the people who are more vulnerable to domestic violence. So we have those in the form of short form videos and advertisements that's going to be popping up on social media. And you can visit the callforchange.info website to get a little more information on Be the One, and we have a couple of our videos up there, so check that out. And then the toolkits. So we have 2 tools, one for children's advocates and one for domestic violence advocates. They both have information about trauma-informed care for children, teens, and survivor parents, how DV affects these people, and how our agencies can work together, as well as work with other organizations and youth. So there are 2 toolkits, of course, from the lens of Illinois, but they can be helpful to be used for a multitude of things. So as I kind of mentioned, those topics there, and I have the QR code up, so if anybody wants to scan those real quick to get those. We will also be sharing the links for the toolkits, and like I said in the panel, they are publicly available, so you will be getting those. So don't rush to get your phone out or anything. And I just wanted to give a little bit of a preview of the content that you would be seeing in the toolkit, anywhere from spotting the signs and symptoms of child abuse. This is the type of page that advocates can print out and just go give teachers and parents and whatever. It has the QR code, which is great for anybody. Information on children's counseling and just working with children's and teens in direct service, as well as like we talked about, those activities and community programs that we can be doing to engage youth. And then just finally, just highlighting our theme this year at the town hall, that collaboration is the way forward. And we actually have several pages on what kind of community collaborations that you can engage in as advocates, from youth as leaders to child welfare to faith partners and school systems. And of course, there's a whole other section on how DV advocates and child advocates can work together. So, oh, excuse me. I need to catch my breath. That's a lot of talking. But we did try to touch on like all the levels of prevention in this tool. I think that we did. So let me stop sharing that. And let me ask my co-presenters this. Do we want to take any questions that might be up now, or do we want to talk a little bit about our individual contributions and what we put in here?
I'm good with either. If we have questions, I'm happy to take those now, but I help to have some of the context from the toolkits, whichever one.
Yeah, maybe if there have been any questions, or if anybody has any so far, maybe, yeah, we could do that now to kind of break a little bit of it up. So I'm just opening the floor to anybody who might want to come off mute or put it in the chat, whatever you feel like doing. While we're waiting on maybe any of those, I can talk a little bit about my personal experience with the toolkit and our partnership. I can say that Chloe and Carrie were such leaders in this partner. I was really happy to be brought on as our person with a prevention perspective. And so the content that was important to me was especially the youth, like the older youth centered pieces. So youth outreach and youth as leaders. You know, for one, keeping up with young people and what speaks to them would be a whole other full-time job in itself. So having, you know, youth that you can really depend on to be those voices for your organization will really help connect with young people. But just secondly, in general, like youth are our future in general and the future of prevention. So working with them is monumental. They're innovative and smart and full of hope, and we need that. And the other piece that was really important for me was like the trauma-informed service to teens. The Child Advocates Toolkits has a little bit more in-depth information on that, working with teenagers who have experienced domestic violence, because of course DV advocates get a lot of training. But we tried to put a lot of content into the little space that we had. So we tried to touch on everything, but and then I just wanted to say that we, like Chloe said, we didn't have a lot of time once this like actually started going. We really only had a few months to put the whole 2 toolkits together. So just it was a lesson in communication being really important and trust being really important, you know, us communicating and trusting that each one of us, you know, would you know, do what we were expected to do. And everybody did, everybody pulled through, and yeah, we couldn't do it without every single person. So I'll let anybody else talk about their point of view, maybe Chloe as the fellow ICADV point of view.
Sure. Well, why don't Stephanie or Carrie, why don't one of you go, since they've already heard from me and Ariana.
Sure, I can go. So kind of like my bio said, and like Carrie mentioned, my previous life was at a children's advocacy center in Bloomington, Illinois. So I was one of the frontline workers, if you will, one of the advocates that this toolkit is intended for. So just being able to bring my expertise now, but also my lack of knowledge then, to the toolkits was a really cool thing, because it led me to do a lot of reflecting on, like, you know, day one, this was my first big girl job out of college, and you don't get a lot of training. You just kind of get thrown in. So thinking back on what I would have liked to know, what would have been helpful to the families and the children that I was serving and making referrals to and having tough conversations with, like, what should I have been equipped with to handle these situations? So that's kind of where my contribution comes into. And I guess to go a little deeper into that, I don't know if people who are on the Learning Circle know what a Children's Advocacy Center is, but it kind of ties it back to why this is relevant for advocates at a CAC to have this toolkit. So a Children's Advocacy Center is essentially kind of a one-stop shop for kids and families who there have been allegations of some type of abuse, whether that's sexual, severe physical abuse, neglect, witness to domestic violence. Instead of going to a police department or a DCFS office to be interviewed, that child and family comes to a CAC for the main purpose of receiving a forensic interview. So this person is trained on how to talk specifically to children about these types of allegations. So with that, there are wraparound services like an advocate, mental health referrals, medical referrals, a whole multidisciplinary team concept. So with that, we would see or do see a lot of children and families who have experienced some type of domestic violence, whether that's violence between the caregivers or whether that is domestic violence or abuse onto a child. So being knowledgeable with information about domestic violence is, I mean, it's just necessary. You have to have it. So I think one of my favorite parts of the contribution to the toolkit was the polyvictimization piece. And I don't know if that's something we initially had in there, but I felt like it was really important because you're only getting a snippet of the information of an allegation that, you know, possibly happened. You don't know yet. So just understanding that with polyvictimization, meaning that this family or this child could have been or could have endured multiple different types of abuse or violence. So if a child is coming in for allegations of sexual abuse, they might also have witnessed domestic violence in the home, but that might not be in the report or the main reason why they're there. But knowing that you still have to consider those aspects because there may be times that you deal with those differently, or you might need to call on other resources in your community, like your local domestic violence agency. So that was really my favorite part of it. That sounds wrong. That's not my favorite part. I guess working on that piece was my favorite contribution to the toolkit. So there were really, for me, no challenges other than thinking back on how little I really knew as a baby advocate. But a lesson just coming, you know, full circle and being like, you know, I did learn a lot over my 10 years, and whether that was by accident or by calling on those experts to come in and do trainings for us. It was kind of cool to see the whole evolution of how that happened. So that was kind of my piece, and I enjoyed every bit of it. So.
I love this conversation. I'm seeing a question in the chat. Do you find that the prevention concepts have been resonating with direct service workers at CACs, child advocacy centers, whose primary practice is in crisis intervention?
So I can tell you that prevention is very much top of mind at child advocacy centers. I think the challenge is funding to provide it, but there is, and I don't know, Stephanie, if you remember what year Aaron's Law passed in Illinois, 20.
It's 2020, but went into effect in 2021.
Okay. So we did have Aaron's Law pass in Illinois, which requires school districts to do child sexual abuse prevention education. And many CACs stepped up to do some of that work. And also, I think the knowledge and experience that Child Advocacy Center staff have in dealing with the crisis helps them to understand the dynamics that can also help them talk about prevention. And so it's definitely a space that centers are interested in. And I think it's also a space where there's a lot of partnerships because there's a lot of different organizations that are doing prevention work. And for example, ICADV. So there are a lot of opportunities, I think, for collaboration and partnering around that prevention space. And then, Steph, I don't know if you want to say anything about you created a prevention program at your Child Advocacy Center.
Yeah, prevention has always been a passion of mine, and there were many conversations about why aren't we doing this? It just kind of makes sense. And then when Aaron's Law did require schools to provide that, that kind of gave us that push to okay, well, schools are going to need this now. So really the start of it was figuring out where do those partnerships lie, doing a needs assessment with schools in our area. Are they already being provided with prevention education? We don't need to, duplicate services. But are there areas that there is a lack of services, or that, maybe our partners have staffing limitations where they can't service all of the area schools? So that is something we found with that needs assessment is our local sexual assault agency was covering our two main school districts. So instead of hitting those school districts, we went rural. We hit all the outside school districts that they weren't able to provide services for just from a capacity stance. So it really is about collaboration with the idea that everybody kind of has a piece in this. And that's not just for students at schools. I also did the Darkness to Light training for adults. So really covering that 360, adults need to know the same information in the same language that we're teaching children, because child abuse is an adult issue. So that's just my little piece out there. So.
Love the way that you phrase that. Child abuse is an adult issue. Is there anything coming up for anybody? Any questions? Any inquiries?
I'm curious, this collaboration and this partnership has seemingly gone so well. I'm curious to hear a little bit more about what made it go well, because I know there's always barriers to making those connections with folks and actually creating such a utilized and informative product. And then also wondering if you all have what's next. Or is there something that you all want to work on together in the future, or is there a partner that you're I really want to connect with them and have, build this same relationship with these folks?
I think I can step in, and then if anybody else has thoughts, I think one of the best things for me that I heard early on in this career, in this position, was we all do a really hard job. Let's just do it together. It's not about competing for resources, even though it feels that way a lot of times. It's not about, well, DV knows this better, or child welfare knows this better. And it's not, but it can feel a lot like that. It can be really tense to be in these rooms with people that there's such stigma, maybe is the right word, but there is often tension between the two entities. And so I will say, and Carrie and Stephanie probably don't know this, but there were times that I was nervous to come into those spaces simply because of that like there's historical tension, not between our agencies, but just between the two forces, the two movements, I guess I should say, even though there shouldn't be, right? But there's all this historical and context. And so there were times when I was like, oh, if I say this, like, how's that going to land with Carrie, or how's that going to land with Stephanie? And I will say, at least from my perspective, both of them were so open and so incredibly insightful that even when I had questions or didn't have a direction, Carrie and Stephanie were quick to say, well, what about this? This is really what children's advocates need. And we've made it work. I mean, it takes that pressure, I think, off of knowing that there can be tension, or it takes the pressure off of the tension to have thoughtful partners that will come into a space and say, you know, let's talk about the issues, or let's just dive right into it. And like Stephanie said, you know, we hadn't considered poly-victimization. That was not part of the original outline. And she just dove right in and was like, I think we need to put this here, and here's why. And I think we need to put that here, and there, that's why. And was a very incredible opportunity for all of us, I think, to learn together. At least from my perspective, I won't speak for everybody, but I really appreciated, like I said, the thought partnership of it all, instead of, you know, one person just saying, well, I think we should do this, and then that's what everybody does. There was collaboration and input from all sides. And I want to keep seeing it. I want to keep seeing all the collaboration. We've asked Stephanie in the past to come do some presentations for us for our domestic violence children's advocate. And I'm presenting at the DAC Advocate Conference next month. Oh gosh, November. Time is whew, all right. Anyway, I'll deal with that nausea later. So there's so many opportunities for us to grow and learn together. And I think the next step for this really specific partnership that I failed to mention earlier was, you know, we've got the campaign, the awareness campaign, and that's going to come out soon. We did the toolkits, those are available. We will also review those annually to make sure, like, if there's new things that are coming out, if there's new resources, new laws that are passed, whatever is happening, that we can add that to those toolkits. And we had printed copies of the toolkits that are, if I do say so myself, beautiful. Seeing those in print was like Christmas morning. I was like, oh my gosh, they're so pretty. But we also have online, obviously, tools, and those will be updated annually. And Carrie, when I told Carrie that, Carrie was like, that's great. Actually, I love that. So she was more than happy to be on board with, you know, working with us again. And then the next piece of this will be some training modules that will come out of the information that's in the toolkits. And so the toolkits are already a collaborative piece, and we're going to have some modules that are available for children's advocates from CACs, children's advocates from domestic violence organizations, and domestic violence advocates, so they can walk through those at their own pace and get the information. And of course, we're all here, always here for our members and the community to answer questions and to assist where they need. So yeah, I saw your comment. It was a mutual respect and appreciation for what each partner brought to the table. And I think that was the baseline we were starting from, and that made all the difference in the world.
I'll just add, I'm pretty excited about future things that could happen. I will say that when we presented the final toolkits to the CAC directors across the state, we have 41 children's advocacy centers in Illinois. They were really excited about these toolkits, and they were really interested in them. And I love that there was already a thought in mind about reviewing them regularly, because they were like, well, we want to have input on what's in these. And so there will be opportunities for them to do that. And Chloe sort of said this, but we have an annual advocate conference that we put on for advocates at children's advocacy centers across the state. And Chloe is coming to talk about the toolkits at the conference. So she is going to be able to directly speak to our advocates across the state, which is really exciting. I think there's a lot of space for cross-training to happen. And I anticipate that will be forthcoming. I will also say, and this is maybe a little bit of news to Ariana and Chloe, because it's sort of developing literally like right now, but we have the Chicago CAC, which is the largest children's advocacy center in Illinois, is actually opening a domestic violence program as part of their agency this month. And so it's a really big collaborative partnership with those two models coming together in one organization. We have another CAC that is likely going to move to be co-located with a domestic violence agency in the next year. And there's a couple more that are looking at that. And so that's literally happening where programs are literally coming underneath in the same building or under the same umbrella. But I've also been asked, I do a lot of programming with the executive directors across the state, and I've been asked to bring together a group of them to talk about improving partnerships with domestic violence agencies. And so I'm going to bring them together first, but I fully anticipate that I will be asking ICADV to participate in that once they figure out what they want to do with that. And so there is a lot of momentum, I think, right now in our state. And I will acknowledge, because I lived it as a local CAC director, there's a lot of old animosity. There's a lot of old how we used to do things. And I believe that there's a shift happening where people are kind of like, we're kind of done with all that. Like, let's move forward. And it's exciting. And so I think this strong state partnership, it trickles down, and there's excitement that's happening in the front lines where people are really interested in partnering in ways they never have before. And I think people are starting to realize, maybe more than ever, we need each other. And there's enough for all of us. There's enough space, there's enough resources. I know we always are saying we need more resources, but there's enough, and we need each other. And so I'm excited really to see how this moves forward in Illinois, because I think we'll be able to talk about a lot more partnerships that are happening. And there's literally ones that are happening right now that are new for Illinois. So it's really exciting. It's exciting to be a part of that. And when you trust your partners and you can do things like this together, it's great. It's really great.
That's so beautiful. And I wonder too if after the height of the pandemic, folks realized how important it was to be in community, whether it's in person or not, but be able to be close and work together with folks after experiencing so much isolation and what that caused. So hearing that those connections are starting to, those silos are starting to break down and those connections are building is the way it should be. I'm seeing a question in the chat. This person shares, in my work with non-traditional partners, whether faith-based, grassroots, or survivor-led, it has been my experience that traditional agencies are hesitant and or reluctant in collaborating with non-traditional partners. Curious, how does your organization currently partner with or view the role of non-traditional service providers in supporting survivors? So y'all definitely touched on working with other agencies and just your view on collaboration, but also thinking about those non-traditional partners. Yeah, what do you all think about that?
That's an incredible and a very interesting question. I know ICADV has not historically done a lot of non-traditional partnership collaboration. And like Stephanie said, we can rehash like 20-year-old arguments all day long, or we don't need to, or Carrie, I think Carrie said that. We don't need to, there's no reason. I think it's moving forward, and I think it's understanding and acknowledging that different people provide different perspectives. ICADV has recently created a survivor advisory group that we hope to eventually put into a formal committee of membership that can offer input on things like this, especially. You know, it would have been incredible to have survivors look at these toolkits and say what was helpful, what stood out to them, what they would have liked to see from it. And so I think moving forward, it's just keeping that eye open and reminding ourselves that we don't have all the answers. And again, we do a really hard work. Let's do it together. We included pieces in the toolkit about partnering with faith-based organizations and other grassroots efforts. I mean, I'm constantly floored. Our domestic violence programs talk a lot about the different programs and like children's groups in their areas that I've never heard of. And I'm like, that's incredible. That's so cool. Like, tell me more. And they're partnering with them and they're finding them. And I think it's important for all of us to remember, especially us as statewide partners, like this movement was not born out of up here. It was born out of grassroots efforts. It was born out of, harboring survivors in somebody's basement because that was the only safe place to go. And we've become very reliant on, funding and government regulations. And I don't think there's anything wrong with that, but I think it is time to remember to get back to those roots and get back to those grassroots efforts. And remember, more or less where we came from and how we need to get back there. So I'll stop talking, but that's my perspective.
I would also add on that, the reluctancy that is something that we are seeing and maybe even seeing more and more and more of. Illinois advocates do talk about that quite a bit. One thing that an advocate said recently that stuck with me, she said, I'm just annoying. I'm annoying. I'll be there. At an event, I'll be there. An open day at school, I'll be there. At the end of the day, obviously, we can't force anybody to work with us or share our resources. But at the end of the day, as long as that organization, as far as your question about their role in the community, just as long as we're helping all of our community organizations, just like get on the same page about like the language to use with survivors and, what resources to give them if they don't feel like they can, advocates should be handling the conversation, right? So resources to give people, where to direct them. At the end of the day, just working towards survivors getting that survivor-centered care. Carrie, Stephanie, anything you would add?
I think the one thing that I'll add to this specific space that I think is from my perspective is really helping people grow is our increase in looking at and responding to human trafficking cases. And there is a lot of intersection with domestic violence and child abuse. And I'm really proud, and I'll just say this is another thing that Illinois is doing. We have a lot of really great work that's happening at the state level around human trafficking. And there is a survivor panel that is informing this work. And it is really great. And I also think like the CAC model is built around a community creating their center. And so there is I think maybe Chloe, you sort of mentioned, like at the state level, we don't always know about all the things, but when you get down to the local level, they do. They know about each other. They know about the different resources. And I think we are getting better at incorporating those things into the work. And from my perspective, I think the human trafficking work that we're doing is really pushing that forward. And I'm proud of that. And there's hard conversations that have to happen with that. And it's so great to have hard conversations together. It really is. So I'm glad that people are open to pushing themselves.
Stephanie, did you have anything? I don't want to cut you off.
No, I mean, nothing outside of what people have already mentioned. The faith-based section was something that I had worked on the toolkit. And again, just pulling from experience, your faith community in your own community is a huge resource. Like no matter what situation you're in, but especially for children and families that are in these types of situations. I cannot tell you how many times I've called on a church for clothes or food or, I mean, monetary donate, like anything. They are willing to help. Um, and from my experience, they want to help in the right way. And so they have been very open to training. I've trained a lot of faith staff in darkness to light, just on the CAC model, mandated reporting. Um, and that involves some of the tougher conversations, like maybe things that are more hurtful to survivors of abuse, maybe things not to say or to steer away from. And they have been receptive from my experience. So I'm probably lucky in that, but I think if you just go into a situation more with curiosity rather than judgment, like we can all learn something from each other, and a resource is a resource. So if this family needs free counseling and there's a wait list 8 months long at, a counseling agency, but they have a local church that they go to, yes, do that. So that's just kind of my piece, and not excluding them from your list of resources just because they aren't considered your standard agency, or so that's, I love them. So
I
Well, and I
kind
think
of,
especially in rural, oh, sorry, Carrie.
do you mind if I just tag on to what Stephanie was saying? I love everything you said, Stephanie, and I also want to say that we are doing better, I think, at viewing people in their complicated whole way, which includes spirituality, whatever that looks like. And so I think that as we, as professionals, push forward that, then you're open to more things that you wouldn't otherwise be open to in terms of serving a whole person and their future resilience, which is also something I want to add, that Prevent Child Abuse Illinois contributed a lot to the toolkits, was resilience, which was also a topic we all felt was really important and needed to be a part of the toolkits as well. Sorry, Chloe, go ahead.
No, you're fine. I was just gonna say, I think the faith-based is important, especially from a rural perspective. I did a lot of work in rural areas in Eastern Tennessee, and faith-based communities come together. And they will do it regardless of affiliation, regardless of whoever it is. But like, I love the way you said that, Carrie, like we're serving people at their human level. And I think we are getting to a place, both in this work and just in general, at least I hope that we are, where we're looking at people as people instead of their political affiliation or their the color of their skin, their orientation, whatever. We're starting to take people as people. And what else? What do you need as this person? And doing it in a very holistic way that does support and grow their resilience. And yes, thank you for mentioning, Prevent Child Abuse was essential in this. Tara was so wonderful to work with and contributed so many incredible ideas, and the resilience factor of knowing that, if a child were in this situation, what does that resiliency and healing look for them? And how can a domestic violence advocate, that's maybe not necessarily trained to work with children, how can that person still facilitate that healing and resiliency? And so that was a critical piece for us as well.
I'm really, really glad that resiliency got brought up, because I'm really upset that I forgot to mention earlier. You might have noticed from the slides that I shared, but a lotus flower appears several times throughout these toolkits and the social media campaign. And the reason for that is the lotus is to represent the resiliency of children and survivors. The lotus flower blooms through that dark, dirty, muddy water on the other side, just beautiful. So that is that visual representation of the resiliency of children and survivors. So I really wanted to explain that. Thank you guys for jogging my memory. Is there any other questions or curiosities that we could speak to in our last 8 minutes together?
While people are gathering their thoughts, I'll say one thing. I really also loved, Carrie, you talked about, you know, as a state and especially at the top, having these hard conversations. And I think it's so hypocritical of us as a movement to constantly expect survivors to have these hard conversations when we aren't always willing to do that. So it's really come to this moment of, okay, well, let's just have the conversation. And you know, we can do hard things. We can do hard things together. Let's just do it and get it done. And it's all for the betterment and the safety and stability of families and their children. And so just have the hard conversation. If you're in a spot at your, you know, wherever you are in the world, and there's a relationship that needs mending, or there's a relationship that's not taking off the way that you want it to, be willing to name that. I think naming it is part of the growth factor. It's part of the getting past it. You have to name it. You can't ignore a problem. It doesn't go away. You have to be able to call it out and talk through it. Yes, we can talk about the map. So the ICADV and CAC both have maps. ICADV's map is, we break out the regions of the state into 5. So Cook, North Collar, North Rural, Central, and Southern. And so we have programs that are in each of those regions and programs that serve specific counties. So a domestic violence program covers every county in Illinois. So that map just illustrates that. And I think that the map that's on our website, you can actually click on and you can type and search. So I think it was created from that. And those are the programs that are in our membership. So there are other programs that are not in our membership that are not listed there, but those are the programs that are in our membership that are on the map. And I think CAC's is similar. CACI's girls map is similar, right?
We do have a map on our website as well. And so CACs cover different areas. So like in the far southern tip of Illinois, there's one center that serves 7 counties. And then up in Cook County and Chicago, there are 5 centers that serve Cook County. So on our map, it's grouped by color, and the color groupings are what one service area is for a children's advocacy center. And then you can click on the star, which shows where that center is located for that grouping area, and it gives contact information for that local center, including their website. And then also our national organization, the National Children's Alliance, also has a feature where you can look for children's advocacy centers across the whole country.
Thank you all so much. We're coming up on the last couple minutes. Chloe, you kind of started to do a last minute, like, here's some advice or a final perspective. I kind of love if we have like 30 to 60 seconds for other folks to share maybe a last piece of wisdom or advice or something that you're looking forward to close out the space.
I guess just a reminder that, like we've said a few times, we all have hard jobs, but like we were always meant to do it together. Humans were always meant to work together. This, you know, more like individualistic approach that we've had, you know, in very recent modern history is it doesn't work for a reason, right? Like we're supposed to be in community, and bringing that back will be very helpful.
I think I just want to remind everyone to take care of yourselves. to take time to fill your cups, to make connections, to do things that help you be the best person you can be when you show up, and be generous, because everybody is doing the best they can. And just, I would just encourage everyone to think about a bridge that you would like to build and take one step closer to building that bridge. Because that's how so much of this work happens, is taking a step closer, making a connection with another human being, and seeing what happens. And I believe when you do that, especially one-on-one in person, bridges build pretty easily. So that's my advice. Take care of yourself so you can show up your best self, and then try one step closer to something that you'd like to do.
Yeah, and I guess I'll just kind of piggyback off of Carrie, like while you're working to bridge that gap, don't overthink it. If you have this feeling or this conversation that needs to be had or a relationship that needs to be built or mended, don't overthink it. Send the email, send the text. Hey, can we meet for coffee? Do you have a second for a 5-minute virtual call? That's really all it takes to start that conversation. And just try to cut out like the outside noise. Like, oh, well, why do you think they're reaching out? Do you think it's malicious, or do you think it's because of this? Find out. Don't overthink it. Go to the meeting and find out. And kind of like Chloe said, have those hard conversations.
Wonderful. Thank you all so much. This was amazing. You all do such amazing work. The toolkit is beautiful. The conversations you all have with each other are beautiful, and seeing your connection to each other is also beautiful. So thank you all for being here. I see last minute advice from Chloe: drink water and cancel a meeting. Go take care of you. I love that. All right, y'all. Thank you all so much for being here. Please reach out to the folks here if you have any questions or want to connect. Reach out to each other to connect as well. Thank you, NRCDV, and please take the survey before you leave. We love evaluations. We love feedback. Thanks, y'all.
Thanks, everybody.